department. We are going to wait one more minute for most of us to join, and Dr. Ben will be giving you all a presentation today on the current pandemic response and situation in Fairfax community. I do have questions that were submitted in advance, so we will prioritize those questions, and if we have time, we'll take questions in the chat box. So I think and then at the end, by the way, at the end of our presentation today, we will have general updates. Elisa and Sarah will have general updates for the group. So without further ado, Dr. Ben, I'd like to introduce you for remarks.
Thanks so much, Sharon. And as I always do when I talk with this group, I really want to begin by thanking all of you for all of the work that you're doing throughout the pandemic and the wonderful support that you all provide to the community. I always say this, but I'm just so impressed with the work of this group. So thank you for that. What I'd like to do is just quickly give a little bit of an update on the pandemic in Fairfax County, talk a little bit about some of the new data that have come out recently, some of it from CDC, and then a little bit about vaccines. But most of the time I'd like to have to answer your questions because I know that there are many questions and many issues that you might be wondering about. So let's jump to the current situation. You all have heard about the surge in pandemic disease that's going on across the country, how we have over 100,000 cases occurring per day. And in Virginia, it has really mirrored a lot of what has been seen in the rest of the country. Virginia statewide had a peak of infection in late May. It came down, and then, as you all know, we opened up businesses and gatherings, etc. On July 1st. Cases around the state then increased again into August, and that was fueled primarily by a surge in disease in the eastern region of the state. Cases again came down a little bit, but now are higher in the state of Virginia than they have been at any time since the beginning of the pandemic. So statewide, we are certainly in a very difficult situation. That isn't the pattern that we've seen in Fairfax. So in Fairfax County, our pandemic peaked at the end of May with about 300 cases occurring in the county on any given day. And it came down rapidly so that at the beginning of July, we were seeing an average of maybe 50 cases per day. But then since then, it has slowly ticked up a little bit by little bit until we come to mid-October. And as of mid-October, then the rate of increase has accelerated. So while we're still calling this, ticking up or trending up or using terminology like that, we're not calling it a surge. It is particularly concerning. In the past several days, there have been over 200 cases in Fairfax County in each of those days. And we haven't had our cases at the 200 level since June 9th. So this is higher than we've been in almost 4 or 5 months. So that is concerning. We also are seeing the proportion of positive tests going up. And so our percent positivity in mid-October was 3.4%, and now it's up to 6.2%. In fact, today is the first time that that percent positivity was higher than the 6% rate. So that also is going in the wrong direction. The increases that we're seeing are occurring throughout the county. And there is no region of the county that has not seen an increased number of cases. We've talked about the racial and ethnic disparities that have occurred, and that the highest proportion of cases, or the highest rate of cases, is occurring in the Hispanic population in the county. In September, we had successfully narrowed that gap. So the Hispanic population in September had a risk compared with the white non-Hispanic population that was threefold higher. And it had been 15-fold higher in the spring, and then had gradually come down, so there was only a threefold difference. But unfortunately, with this recent increase in cases, we've seen a widening of that gap. In other words, a higher proportion of these new cases have occurred in the Hispanic population, while recognizing the increase that has occurred in all racial or ethnic groups. Most disease continues to occur in the adult population, with the highest rates of disease among adults 25 to 34 years of age, and then in the 35 to 64-year age group. So this is still in the adult population. A little bit of an increase in 10 to 19-year-olds, pretty flat in younger children, and that's good news. Let me share a little bit about kind of what's new. Some of the, well, let me jump back a second. So why is this increase occurring? Why are we seeing an increase in Fairfax County? And the answer is we don't have a clear answer. We attribute it to pandemic fatigue. We attribute it to people perhaps not being quite as careful with their mask wearing and social distancing, perhaps wanting to get together more often with family and friends. One of the studies from CDC showed that there was a threefold increased risk associated with going to a restaurant. And so whether this reflects more people eating out, that's a possibility. It could potentially be related to the change in the weather, and that as it's colder, more people are spending time indoors. But we really don't have a clear indication of why the numbers are increasing in our county. Just the supposition that this may reflect maybe more people indoors and more people having some difficulty maintaining that rigorous social distancing and face mask wearing. So let me jump to some recent data. CDC has just published a brief that talks about wearing masks. And previously, masks were always promoted as something that we do for the community. So that if I wear a mask, then that protects other people around me. And that if we all wear masks, we are all protecting each other. And that certainly still remains true. But recent data that CDC has analyzed also suggests that wearing a mask protects the person who is the wearer and not only the people who are around them. And so some of those data are from laboratory studies that show that face masks are effective at filtering out particles, and that a multi-ply cloth mask made of cotton or some other fiber where the thread count is reasonably high can prevent 50 or 60% of the respiratory particles from passing through that mask, potentially infecting the wearer. There also are a lot of data showing the effectiveness of masks in general. And while from those studies, it's very difficult to separate the protection of the wearer versus the trapping of particles and protecting others, what we do know is that empirically from a wide variety of different studies, that masks are really effective. So if we're going out there and we're promoting and we're reinforcing one thing, masks is really something to be very strong in terms of promoting mask wearing. So that's one thing. Let's talk a little bit about vaccination. I'm sure all of you have heard about the early analysis of the data from the Pfizer trial. So Pfizer is one of the pharmaceutical companies making a candidate mRNA vaccine. There is one other company, Moderna, that is using that same technology. And then there are several companies using other vaccine technologies. So Pfizer is the first one to share some of its results. They haven't done so in a scientific journal, but they've done so with the mainstream media. And what they say is that the vaccine is over 90% protective. They are going to submit a request for an emergency use authorization to FDA probably next week. It's not clear how long it will take FDA to review that application, but if it takes several weeks, we could have the first doses of vaccine coming to Fairfax County toward the middle or end of December. The Advisory Committee on Immunization Practices, which is CDC's Federal Advisory Committee for Vaccination, has not yet made recommendations on the targeting of those early doses of vaccine. But all of the preliminary information that we have suggests that the first targets for vaccination are going to be healthcare providers, and that's broadly, not only in hospitals and physicians' offices, but even in places like nursing homes, where the staff will get vaccination. And then also will be first responders, so police, fire, and EMS. Then after that, we're going to most likely vaccinate high-risk individuals, people who are elderly, people who are in nursing homes, people who have underlying diseases, and then people who provide essential services, essential workers. And that all still remains to be defined. The county is busy planning for how that vaccination will occur, and it will be a combination of vaccination by facilities, like Inova, for example, will vaccinate its own folks. Long-term care facilities will vaccinate their staff and residents. Pharmacies may provide vaccination, and private doctors will as well. And so that planning is still ongoing. And that's something certainly we can talk about if there are questions. Let me stop there in terms of the background. If you do have any questions that you wanted to put in the chat, Sharon will be monitoring that. But let me just really quickly jump to some of the questions that were submitted in advance. Is that okay, Sharon?
Yes, and Dr. Ben, Sarah Allen would like to make a brief announcement to the group if anyone is having technical difficulties.
Dr. Ben, thank you so much. That was wonderful, as usual. So if anyone is having any challenges with putting questions in the chat, please email Jessica Rhodes, RHOADES, at fairfaxcounty.gov, and she will then put your question in the chat. So just wanted to make sure that everyone would have an ability to ask you questions. If we don't get to them all, because I do understand that you have to leave by about 2:05, we will take those questions and make sure we get everyone the answers. So thank you, and take it away.
Great, thanks so much, Sarah. Okay, so let's go to some of the questions. The first question is further analysis on more specific risk factors. So the biggest risk factors are not wearing a mask, obviously, not socially distancing, and eating in restaurants, eating with other people. You know, in so many places, we find people maintain good social distancing until they decide it's time to eat. And then they're all sitting around a table with each other. They've all got their masks off. They may be talking loudly. They may be laughing. You know, this is really a high-risk situation. And so I really want to emphasize that it's important. You know, we talk about school teachers, for example, and the school teachers may be really good in the classroom, but then when they're on break, they don't kind of maintain the same rigor with their colleagues that they do with their students. And so that's something that we just need to be really good at. In terms of the surges being experienced in other parts of the country, does the health department have any new or different recommendations? And what I would say is that the state of Maryland just recently increased some of their restrictions. They've reduced the occupancy in stores and at restaurants, I believe, to 50% of capacity. So far in Virginia, we haven't had any new restrictions, but I think the thing that we would want to do in terms of our recommendations is just really emphasize the stay the course idea. The idea that we need to celebrate safely, the idea that we have to really fight against mitigation fatigue that many of us are experiencing as we move to the holidays and want to get together with family or friends. So it's really, you know, the thing that stands out about Fairfax is how successful we've been since July, since reopening. And whereas other locations around the country, we've seen surges, other locations around Virginia, we've seen surges, Fairfax has been amazing in terms of not having any surge since reopening until the increase that we're experiencing now. So if only people could get back to those same behaviors that were so successful before, I think that's really what we have to emphasize. Do we anticipate another closure of businesses? I don't think we'll see something like what we saw last spring, but given that Maryland has restricted occupancy, I might anticipate that this could be something that Virginia would be considering as well. So there's a question of what are the best sources of information on the rate of community spread in specific areas of the county. On our dashboard, we do have a map which shows rates of disease by zip code, but these are cumulative throughout the course of the entire pandemic. And so they don't show where cases have occurred recently. I can tell you from the data that we have that all areas of the county are going up, all regions of the county. And so it really is not something that's localized in one area of the county, but unfortunately that data is not generally available. What are current recommendations for in-person religious gatherings? And Sharon, if I'm wrong, correct me. But from what I read from the Virginia Department of Health, religious gatherings don't have a particular cap on the number of people who can be involved. But they are limited to the religious service part of the gathering, so that, for example, if their services, you may have more than the 250 person limit for gatherings. But then once the service is over, you can only have 250 for any subsequent events. Hopefully, they're not having meals, for example, after services that might include so many people. Also, religious institutions are required to maintain the social distancing and the mask wearing. And you can imagine that these are potentially high-risk settings, given the number of people that are involved, given the singing that may be occurring. We've had several outbreaks at religious institutions throughout the county. And when we've gone to the websites of those churches, what we've seen is that people appear not to be maintaining social distancing as well as they should. So I do think that in that setting in particular, people, again, need to remain rigorous in terms of how they implement these mitigation measures. A question about how many times do we follow up with a COVID-19 patient? So let me explain a little bit about our containment strategy. which we call Box It In. So the four components of this box are, first of all, testing, case investigation, contact tracing, and then the fourth side is isolation and quarantine. Health department investigators find out about every single case occurring in the county. They reach out to that case and identify who the close contacts are and provide recommendations about isolation. They have successfully been able to reach about 90% of all the cases. And where they aren't able to reach them, it's because the case doesn't answer the phone, doesn't respond to electronic outreach or to mail outreach. One of the things they ask those cases is whether they need any help in order to successfully be able to isolate themselves. And you all know we have a cadre of about 60 community health workers that can provide support to people who need help in order to isolate successfully. Then once contacts are identified, they go to a contact tracing team. And that team also has been able to reach about 90% of those contacts successfully within the first couple days of trying to do so. And then those contacts are quarantined. And again, if they need help successfully accomplishing that quarantine, they can get help from the community health workers. And I'm sure that many of your organizations are providing help in those settings as well. Finally, we have a wellness team, and there's an electronic system called SareAlert that contacts these cases or these infected people and their contacts every day electronically to make sure that they are getting better and that they're complying with the isolation or quarantine. So the outreach does occur every day during that isolation and quarantine period. The next question had to do with testing, where to go if insurance doesn't cover the testing and how to navigate the different options. On our website, we have a list of over 50 places around the county that do testing, and many of them don't require insurance. And so being familiar with that document and where to find it, I think is the first part of the answer. And Sharon just listed that website. The health department also is opening several fixed locations to do testing. And this would be particularly for people who are having more difficulty accessing testing through their private healthcare provider or through other mechanisms. In other words, this would generally be the underserved population. We have one of those sites operating in Annandale, and we are opening additional sites next week in Centerville and in Springfield, and then expanding some of the other testing options that the health department is providing. So Sharon will provide updates to all of you with where those fixed sites are when they are up and running. There are a number of questions about returning to school. What metrics is FCPS using to inform themselves about returning cohorts? And this is an ongoing conversation. We've been talking with the administration. They've been talking with the school board. And part of what they're looking at is the rate of disease in the community as an indication of where they should be going in terms of reopening. And part of what they're looking at is how well the mitigation measures can be applied in the school setting. Because if the mitigation measures can be successfully applied in schools, then even if the disease in the community is high, there will not be transmission. So it's really a two-step process. The first step is introduction of the disease in the school, and the second step is transmission in the school. And if we can do mitigation well, we can keep that transmission from occurring. And that's what is being done in countries like Germany and many European countries that have opened schools despite ongoing pandemic disease. And actually in Fairfax, we have our SRS, Supporting Return to School program, that is run by Neighborhood and Community Services. that has been very successful in preventing transmission. In fact, for the past several weeks, there have been no cases, and before that, there were several cases in staff, but only perhaps one occurrence of transmission to a child. So it can be done successfully. What guidance are schools receiving regarding what to do if there is a positive? And the health department in the schools have been working on procedures if there is a positive. And we will basically be following our rigorous contact tracing process, just like I described before. And then the final question I have is, do you think schools will be able to open for all children in January? You know, there are a number of things that go into answering that question. Certainly, we can't predict what the level of disease is going to be in January. For the cohorts that are coming back to school before then, if that occurs, we'll certainly gain some experience from that. And then I think the other thing that I don't really know is the willingness of teachers and of staff to come back to school, and whether that will certainly play a role in terms of whether schools reopen. So those were the questions that were submitted in advance. And Sharon, do you want to give me a few of the ones that have come up during the call?
Yes, thank you, Dr. Ben. So in the chat, going back to the presentation and the information you gave concerning the vaccine, and you mentioned that the current vaccine that we're hearing a lot about is 90% effective. So the question is that good? And how does 90% effectiveness compare to the seasonal flu vaccine?
Great questions. 90%, and I think what's come out in the media is over 90% is pretty good. It is a little bit less effective than something like a measles vaccine. It is certainly far more effective than a flu vaccine, which tends to be about 40 to 50% effective on any given year in terms of preventing infection. What we don't know yet, because the scientific data haven't come out, it was basically just a press release, is we don't know the effectiveness of the vaccine in different segments of the population. So whether it was 90% among the elderly, for example, that's something that we would still like to find out. We also don't know whether the getting vaccinated, even if you do become infected, decreases the severity of the infection. So I mentioned that flu vaccine may be 50% effective in preventing infection, but it's 90% effective in preventing severe infections, hospitalization, and death. And so this vaccine, if it's similar, could have a better profile than just the protection against infection alone. Finally, we still have no idea how long the vaccine protection occurs for. And that's obviously something that we can find out only over time.
Thank you. And we have another question, again, related to the vaccine. What can you say about the concerns over the use of an mRNA vaccine? As I understand, Pfizer's vaccine is the first time this has ever been attempted.
Yeah, mRNA is really an interesting vaccine technology. And so if you deliver that genetic material in the vaccine, it goes into the cells and then turns on the cell's machinery to produce an antigen, a piece of the COVID virus, not the virus itself, but a piece of the virus that then your body's immune system reacts to. So it's a really neat technology, and there is no reason a priori to suspect that there are any significant side effects associated with this technology. In addition, in the vaccine trial, again, to our knowledge, there have been no significant side effects that have been identified. And so even though this is a new technology, both theoretically and from what we know so far, I think it's likely to have a very good safety profile.
Great, thank you. So there is a question here, and I'm not sure you can answer this, Dr. Ben. Is Fairfax County Public Schools participating in the National School Dashboard?
I don't know about a national dashboard, but I do know that the state of Virginia, I think, is establishing a dashboard for schools as well. And so I do believe that the data will be available on disease in the schools or on outbreaks in the schools. I don't know. I don't think that would include single cases, but outbreaks.
Is that data that's being sent from Richmond, from VDH, or is Fairfax inputting in the data?
It would be VDH data.
And just real quick, just since I asked the question about it, to be clear, it's not like I used national. I didn't want to give the impression that it was a federal thing. It's being coordinated by Emily Oster out of Brown University, and it's voluntary, but she's been getting hundreds and hundreds of school systems all sending their data to be able to build a national set, since there isn't any national data out there. So it would be cool if Fairfax was participating, because it would help those numbers somehow.
Okay, that was good timing, Dr. Ben. We actually do not have any more questions in the chat right now. I will check the survey that was sent in advance with the meeting invite to see if there are any outstanding questions or if we need to provide some resources for you all. But Dr. Ben, thank you so much. We are so appreciative of your knowledge and your commitment and your guidance.
I just wanted to say again, I'm so appreciative of all your work and your commitment. And I'm always happy to answer questions and to help out with this group in any way I can. So thank you, Sharon and Sarah. And now I will talk to my bosses.
Thank you so much. We appreciate it.
Okay, bye-bye.
If everyone could stay on, we just have a couple more announcements we want to make. And I'm going to turn it over to Elisa in 1 second, but Sharon, you noted that people could also continue to put questions in either the chat or the survey. Is that correct?
Yes, I think the survey is still open. So how about by the end of tomorrow, I'll look and see if there's any more questions, like follow-up questions for Dr. Ben. We didn't really have a whole lot of time. So I'll check that survey again. It was in the meeting invite that Jessica sent out last week.
Great, that's
Monday,
perfect. And we can
that day was.
Yeah, earlier this week. We can always have Dr. Ben back too. In a couple months from now or what have you. So that's great. And thank you all for joining us. I'm going to have Elisa close it out with some an announcement, but we will also look to send the recording out to you all, the links that Sharon gave, and any kind of questions that we have. We'll send that out as an attachment to our email so that you could then forward it along so people could watch this presentation. Elisa, go ahead.
Good afternoon, everyone. I hope everyone's having a good day. Just two quick announcements. I want to remind you that the full community provider strategy team will be meeting next Thursday from 1:30 to 2:30. And we will be sending out that meeting invite. Immediately following that meeting, the Partnership for Healthier Fairfax is going to be having an education session starting at 2:30. On how to interpret health in all policies where you live, work, and play. They're going to be sharing health and equity in all policies successes in multiple sectors as well as in nearby communities. And so we would absolutely encourage you to register for that session as well. Again, it's being offered by the Partnership for Healthier Fairfax, and I am going to right now include that link in the chat, and we will make sure to include it in the meeting notes as well.
Thank you, everyone. And if you have any other suggestions about information sessions, please feel free to share them with Elisa and I, and have a great afternoon.